This brief introduction explains the threshold limit graphical approach, a method used to ask clinically relevant questions using data. It helps clinicians understand issues like, what are the outcomes when considering only patients within a certain group? When using a particular metric in clinical practice, which threshold levels are significant? Should I avoid using treatment X in patients whose preoperative metric is above a certain threshold? Threshold limit graphs can help clinicians identify important metrics and relevant thresholds for each metric, and thereby make more informed decisions about patient care. The threshold limit graphical approach was first described in a paper that is available for free through Curious. Here is an introduction to the anatomy of a threshold limit graph using data from a study where the post-operative neck pain and preoperative age were recorded. Each threshold limit graph will have a blue and a red line. The blue line has markers pointing to the right, and the red line has markers pointing to the left. The leftmost point on the blue line in this graph documents the average pre-op neck pain score, including all patients of all ages. The rightmost point on the red line in this graph also documents the same average pre-op neck pain score, including all patients of all ages. Moving from left to right on the blue line, data for younger-aged patients are dropped from the calculation of average neck pain. For example, this point documents the average neck pain score, including only patients older than 46 years. The direction of the marker helps to appreciate the exclusion criteria. The red line is interpreted in the opposite way. Moving from right to left, data are progressively dropped for older age patients. For example, this point is the average neck pain score, including only patients younger than 38 years. Each threshold limit graph will have a shaded region that documents the variability in the outcome when all of the data are included. The shaded region documents the 95% confidence interval. In this graph, the sample size is fairly large, and this shaded region is narrow, indicating high confidence in the average neck pain score when all ages are included. When the sample size is small, this shaded region will be much wider. The ends of the blue and red lines will always include only data for a small number of patients. In this graph, data are plotted only if there were at least 4 data points available to calculate the mean for that threshold. Threshold limit graphs are valuable tools for analyzing data and identifying relationships between variables. Here's how they can help. 1. The leftmost point on the blue line represents the average outcome for all patients, providing a baseline for comparison. 2. The width of the shaded region indicates variability in the data. Narrower shaded areas reflect less variability and higher data reliability. 3. If the red or blue line consistently moves away from the shaded region, either above or below, it's unlikely due to chance. This pattern helps you identify above average or below average treatment responses. 4. The extent of deviation from the shaded region shows the magnitude of the effect that the variable on the x-axis has on the variable on the y-axis. 5. By observing where the line rises above or falls below the shaded region, you can select thresholds that distinguish between average and exceptional treatment responses. These thresholds can be used to group the data for further analysis. 6. Once thresholds are established, you can use conventional statistical methods to test for differences between the groups defined by these thresholds. 7. Besides plotting mean values on the y-axis, you can also plot median values, or the proportion of patients who achieved a clinically important difference compared to pre-treatment. By utilizing threshold limit graphs in this way, you can effectively interrogate your data to uncover significant insights and inform clinical decisions.